All right, Miss Haynes, how are you doing today?
I'm okay.
So I just wanted to meet with you today. I've done the interview with you, and I've also done the interview with Holly.
hmm
So I wanted to just give you a little bit of an overview as to what I see might be going on.
Okay.
And we can also talk about, what the future holds and what we can do as we look ahead towards treatment.
Okay.
So first, I just want to start by saying that it seems that a lot of her symptoms started after her brother was incarcerated
hmm
and everything that was surrounding that. So that's definitely going to be an important part of the treatment that we have with Holly.
hmm
We want her to explore these feelings about this whole situation because I don't really think that she's appropriately processed through it.
Okay.
Also, the most prominent of her symptoms seems to be her recent problems with weight, her counting calories, her desire to be thin, talking
Yeah.
about weight on all these websites.
Uh-huh.
So I think that's going to be the major part of our treatment. And I think before we do anything, we're going to have to focus on that.
hmm
And all of it, obviously stems from an unhappiness about the way she looks. So basically, I think this might be indicative of something called anorexia nervosa. So I just want to give you a little bit of a description of the disorder. So those with anorexia don't maintain normal body weight. Their body weight is below what's expected. So I believe Holly's body weight is about 90% of her recommended weight.
hmm
And anorexia typically begins once people reach that 85%. So she's very close to it. So it's
Okay.
definitely going to be something we're going to want to, get a hold of.
hmm
Also, those with anorexia have an excessive concern about their body shape and weight, which is definitely seen in what Holly's been doing.
Okay.
Also, they deny the seriousness of the low body weight.
hmm
And as you said, she doesn't seem to really be unhappy with what's going on.
Right.
So that's definitely something that she shows.
hmm
Also, everything that she's been showing would fall under something we call the restricting type. There's the restricting type and the purging type.
Okay.
The restricting would be, restricting what she's eating and not
hmm
getting the full, her full meals.
Okay.
And also, I know you said that she is not engaging in any purging behavior, and she
Right.
also denied that to me. But you did say that you've been eating dinner with her, and you've been feeding her, but she's also losing weight. So at the same time, I definitely want that to be on our radar as something for us to look for in the future.
Okay. Do you
Um,
think there's a possibility of her purging eventually, or?
It could lead to that.
hmm
Right now, I'm just seeing mainly the restricting type, where
Okay.
she's really, counting the calories and everything.
hmm
But we want to open the line of communication between her and me, and also her and you guys, just so it's all on the table and she feels comfortable talking about any of those behaviors.
Right.
So eating disorders, the rate of them has risen a lot, especially with the internet becoming so popular
Right.
and a lot of these media sites. People are able to talk with friends and other people on the internet who are having these problems, but it also exacerbates the symptoms because
hmm
they begin to compare themselves to one another. Also, there's a genetic component to this, and it can also be caused by something in Holly's neurobiology, so a dysregulation of some hormones and neurotransmitters. Another thing that's really important to realize is that she's in a really sensitive period of development right now. She's
hmm
right before her teenage years.
Yeah.
So this is the
Definitely.
time when a lot of teens, think a lot about their bodies and compare themselves to others.
hmm
So it's definitely normal that this is occurring at this stage.
hmm
And then another thing I wanted to talk with you about is something called the thin ideal, which is where teenagers, really anyone, is reinforced for being thin. It's something that's just in our culture. And this thin ideal can come from peers, it can come from parents, it can come from the media, all different sources of information.
Do you think that my husband and I might have helped cause this?
Well, I mean, with any disorder in general, it comes from a variety of different factors: genetics, the environment,
hmm
peer interactions.
hmm
But it is, the research does show that parents who are a little bit more highly critical and expect a lot out of their children and show that will, pull for a little bit more of these disorders to
hmm
occur. And there's also, a lot of research about the associated features that go along with anorexia, including depression, anxiety,
hmm
substance use. So that's something we're going to have to look out for.
Okay.
Um, so the course of anorexia typically starts around age 14 and 18, just because those are big transition periods into the different, middle school and high school, college. So transitional periods are really sensitive periods for those who are developing
Right.
anorexia. And even though she isn't at that point yet, her brother leaving and being incarcerated definitely would, constitute a transition in her life, and this could be a reaction to that.
Yeah.
And I think that it might be.
Her symptoms definitely did really start to show once that happened, which made us really worried.
Yeah, so it's definitely something we're going to want to look for and, talk to her about. Also, those with anorexia, some recover after one episode, so this might just be one thing she's going through and she'll, it'll pass. Others experience more of a chronic state of the disorder. So we'll just have to keep an eye out for that. Also, those, individuals are more responsive when treatment happens earlier on, so I think it's awesome that you guys got her in as soon as you saw these symptoms coming about, and I'm really, positive about what we can do with Holly and the disorder. So for treatment, there's a few different options I just want to talk with you about, and then we can talk about more specifics of what that's going to look like.
Okay.
So the first stage for a lot of people with anorexia is inpatient treatment. And I know that might sound a little bit scary. Yes, but the main focus of this is to get her back on track with eating patterns, eating habits. We want to make sure she's maintaining her body weight. So that's the first step. And then also, it's really great in these inpatient settings, there is a lot of group therapy. And they use something called supportive confrontation, where they have members in the group who have been there for a while, and then also the newer members. And the older members are able to point out, things in the newer members that they saw in themselves.
Right.
And it shows them, the process of how the treatment goes.
So would she live? She would stay at the hospital? She would be there all the time?
She would, yes. There's also partial hospitalization programs where she would stay at home, and then she would go to a day program.
What happens with school?
We could definitely communicate with the school. I think it's really important for us to have open communication with the school and let them know what's going on. And I will help you with that the entire way, and we'll make sure that she isn't missing out. We just want to make sure that right now her weight and her health is the first thing on our mind. And then after the inpatient treatment, a lot of people do family therapy, which I think would be really, really important for you guys. So we'll do a structural family therapy where we work on family dynamics. We talk a lot about communication skills and open up that communication between you guys and Holly. And a big portion of it focuses on autonomy. A lot of Holly's behaviors indicate that she really wants independence. She is doing a lot of risky behaviors that we're going to want to, look at.
We're really worried about those.
Yeah, and so we want to make sure that we talk to her about how it's appropriate to, voice her independence and do all these behaviors that make her feel more autonomous. But at the same time, we want her to be doing, healthy and safe behaviors.
Right.
So we're going to talk a lot about that. What autonomy means for you and what it means for her. Also, I think it's important for you guys to know that about 80% of people with anorexia meet the criteria for another disorder. So it's very common.
Another one.
Yes, but it's very common because they all go hand in hand. It's all interrelated. So in Holly's case, I think she might be suffering from a little bit of depressive symptoms. And those could have come from her brother being incarcerated. So I think that, in my opinion, when he was incarcerated, she began going into a bit of a state of depression. And then those depressive symptoms eventually led to the eating disorder. So after we deal with the eating disorder, get her back on track with her eating habits, I think we're going to then move into talking about the depression she might feel around her brother.
Right.
So I just want to let you know, depression out as it relates to Holly, because I want to make sure this is very salient for you and you can see where these symptoms are. For the past 6 months, she's experienced depressed and irritable mood, also a diminished interest in school, but it's also promising that she's very interested in other activities at the same time. So it's not like she has a complete loss of interest in everything,
right?
Which is a good thing for you guys to see in her. Also, she's had a significant change in appetite and weight. You mentioned that she feels worthless. She also might have some thought and concentration problems, especially during the school day.
Yeah.
So for depression, it's partially determined by genetics. There's also some evidence of it being a dysregulation with neurotransmitters, other brain chemistry type of stuff. But once again, it's a mix between, biology and the environment.
Right.
And like I said, the stressful life event of her brother leaving most likely caused it. And she's kind of up in arms about how she should be handling it. So we're going to really focus on that. So for depression, it's more common than you might think in adolescence. It's actually pretty
Really?
typical. Yes. So it's nothing to be too alarmed about. Like I said, it's a very sensitive time in development.
Mm-hmm.
So, it's not surprising that these things would come about.
Okay.
Also, it's more common in females. It typically comes on quickly, and there's an average age of onset between 11 and 14, which is right where Holly is. So, again, it makes sense, and she is, this is typical. So, it's
Mm-hmm.
not something to be too alarmed about. It's something that we can definitely treat.
Okay.
Also, it usually lasts about 3 to 9 months. It's something called a major depressive episode, so it is only for a brief amount of time.
Okay.
It's not something, it could turn into something more chronic, but right now we just want to focus on this one episode that she's in.
Okay.
Also, we're going to have to be on the lookout for some suicidal ideation.
Mm-hmm.
Right now, she's just engaging in more self-injurious behaviors,
Mm-hmm.
but we want to also keep an eye out for that. So I'm going to ask you to help me in monitoring that.
Well, we already do try to make her. We always check for that already,
Mm-hmm.
which she gets kind of irritated with, but we're just trying to look out for her.
Yeah, no, that definitely makes sense. That was another thing I wanted to bring up.
Mm-hmm.
A lot of, children do engage in self-injury, and there's many reasons that they do that. One is to punish themselves, which would
Mm-hmm.
make sense with her eating disorder. She might be unhappy with her body,
Right.
and this is a way of kind of lashing out at her body. Also, with the depression, she might just not be feeling anything, and she engages in these behaviors in order to feel something.
Right.
So, looking ahead to treatment, I think it's going to be really important for us to come together and to talk to her about why she engages in these behaviors.
Mm-hmm.
Not really just pointing them out and saying that it's inappropriate,
Right.
but getting her perspective. So one thing I would like us to try, and I understand 100% that it's going to be difficult, but I want you to know that I'm here to help.
Mm-hmm.
We're all going to work together, is to stop the monitoring of her self-injury.
Completely.
We're gonna try it first. I know I understand. Like I said, it's definitely a scary thing to think about. But she does that. And one reason why she might do that is just to feel some control. And if we give her some more independence and more autonomy,
Mm-hmm.
and she's seeing that you're willing to work with her on that, then she might stop it on her own. And we're gonna really, really help her find healthier ways of coping with the anxiety and the depression. So that's gonna be our first step. Also, for depression, another means for treatment is medication.
Mm-hmm.
Right now, I don't see that as being all that necessary in Holly's case.
Right.
Like I said, I think we're going to have to focus on the eating disorder first. And then once we do that, we can revisit the depression and the need for medication. Also, for treatment, I think we could look into something called cognitive behavioral therapy, where we're going to talk about her distorted cognitions and thoughts about her body, about, just things in general,
Mm-hmm.
and all of those distorted cognitions affect her mood. So once we're able to work with those thoughts, hopefully it'll improve her mood.
Mm-hmm.
Also, another thing that I think would be really great for Holly is interpersonal psychotherapy, which will help her cope with some social stress.
Okay.
I know she feels a lot of it sounds like she feels a lot of pressure to be thin and to fit in with her friends.
Right.
So this is going to help her with that. This interpersonal psychotherapy looks at a loss of a relationship. And for Holly, this would be the loss of her brother and the loss of her friend.
Right.
So we're going to acknowledge the fact that, that is a loss. We're going to help her mourn that loss. And at the same time, we're going to help her find, alternative sources of social support.
Right.
And you guys will be the first step towards that.
Mm-hmm.
So again, we're going to do a lot of family therapy. So yeah, again, all in all, I think we're just going to have to get Holly the help she needs with regard to her eating disorder first.
Mm-hmm.
We can talk more specifically about that and what it's going to look like, and meet with her and talk with her about it.
Mm-hmm.
And then once that's more under control, we can go into the emotional aspects of this and the depression.
Right.
And really work through the fact that her brother isn't here anymore, or isn't here anymore in the way that he was.
Mm-hmm.
So yeah, do you have any questions about any of this?
Not right now, but I'm sure I will as time goes on.
Okay.
Mm-hmm.
Well, just, know that you can come to me whenever, and we're all going to work on this together. And it's definitely not something to be too worried about. I mean, obviously you're a concerned parent, and that's understandable, but this is definitely something that we'll be able to treat. So.
Okay.
All right. Thank you.
Thank you.